I'm looking forward to a very nice intellectual session. Thank you so much. Dr. Avneesh.
Yeah, so I can start now.
Yeah.
Okay, so maybe people will keep joining. It's still 2-3 minutes left, but I'll get started so that people can keep joining. Yeah. So this is our topic today. It's about practical use of AI in day-to-day practice of pain medicine. So those of you who don't know me, many of you might be knowing, I have my background in pain medicine. I did my MD in anesthesia from SMS. Then I did a PDCC in pain management from BHU. After that, I practiced in Udaipur. Then I went to Middle East, UAE, where I got exposed to emerging technologies. That is how I got initiated into this field of AI. And during the next 1.5 hour, we'll be going through this topic. And I have divided it into 3 parts. So initial 20-30 minutes will be a bit of theory. Then the next 20-30 minutes, we'll see a bit of hands-on. And finally, we'll have a Q&A. So,
all right.
Yeah.
So let us wait for 2 more minutes because I'm sure there are a lot of fans who really want to and they wouldn't miss. So
yeah, sure. I'm okay. I can wait. Yeah.
Yes. We are awaiting the Vizag president also, Dr. Praveen.
Madam,
So
I'm there.
Yes.
Madam, I'm there. I'm here only.
Yes.
Hello, Dr. Praveen.
Sir, good evening, sir. Good evening.
Good evening.
So we are here today to be honored by your presence, Dr. Avneesh Khare. We are really proud from the pain medicine community that you have taken the path ahead. And since you know anesthesia on one side, then comes pain medicine on other side, and then to take up AI to a depth that we have not understood. Because if I go through your CV itself, I think people are going to decode each line. So the only thing that I think I can pronounce is BrainX AI. The rest are, the ventures and the titles that you have gained. It is an eye opener. So hearty congratulations. We from the Indian Society of Study of Pain, along with we have our esteemed president, Dr. Sanjay Khanna, and our honorary secretary who will be joining online, Dr. Anurag Agarwal. We welcome you. And we welcome all the participants today whose curiosity and learning quest has led everyone to be part of this ever-growing knowledge. And I welcome the Vizag ISSP branch, the Society for Study of Pain. I would hand over both to the president, Dr. Praveen Kili, and we also have their secretary, Dr. Shrikant. So over to you, Dr. Praveen. Would you like to say a few words for today?
Yeah, good evening, ma'am. Thank you. Dr. Avneesh, sir, good evening.
Good evening.
On behalf of SSP Vizag City Branch, I would like to thank the ISSP National Headquarters, President Dr. Sanjay Khanna, sir, and Secretary Dr. Anurag Agarwal, sir, for giving us this opportunity to co-host this important webinar. I feel this artificial intelligence is very much required these days, along with our clinical skills. And from our specialty, from pain medicine, someone like Dr. Avneesh to specialize in artificial intelligence in pain medicine is something which, when Dr. Anurag sir was mentioning this, I was actually surprised. You left pain medicine and chosen artificial intelligence as a specialty. It's very nice to hear this, sir. And I welcome you and thank you for being the distinguished speaker and Google certified AI specialist. And Hello, am I audible?
Yeah, we can hear you.
Thank Dr. Sweety Purushotham, madam, our dynamic national GC member, for accepting and moderating this session. I'm sure this talk will enlighten all the young and senior pain physicians across India. We have crossed more than 300 registrations. That's very good news. And I'm enthusiastically, eagerly waiting for this topic. Dr. Avneesh, sir, Thank you for accepting this request and giving this lecture. Dr. Srikanth. Hello, Dr. Srikanth.
Sir.
Yeah, over to you, Srikanth.
Oh, thank you, sir. Thank you, Dr. Avneesh, and thank you, ISSP National Headquarters, for this opportunity to co-host the webinar. So, without much delay, we'd like to start session as and when Dr. Sweety gives a green signal to go ahead with the talk. Thank you, Dr. Avneesh, sir, once again.
Thank you.
Dr. Sweety, are you there? I think it's 7. It's 7. Dr. Sweety, can we start?
Yes, I will give a brief of my foray. So the ISSP Congress, World Congress, it was celebrating 50th anniversary in 2024, just 2 years back. It was in Netherlands. So there was an entire arena for artificial intelligence and the newer modes, how we could incorporate. And I was selected in my poster presentation, which was artificial integration of the AI into fibromyalgia. So that was my topic. And I had a lot of inquiries from the European countries, from Japanese, who are much ahead in this particular area. So it's a honor that one of our own has made this possible, that we can actually learn and understand where we as Indians who are ahead in IT industry and also ahead in healthcare, we can combine both and make a practical use of it in our day-to-day practice. So over to you, Dr. Avneesh Khare. The stage is yours. We welcome heartily, and let us all hope the other participants will be joining soon. Thank you.
Thank you, Dr. Sweety. And again, let me thank the organizers, ISSP platform, Dr. Anurag sir, Sanjay sir, ISSP Vizag team, Dr. Praveen. We had a few chats on phone before this webinar. It's nice to be in person with all of you here. My journey, I'll be sharing a bit of my journey, how I ended up here, because I know there might be question in minds of people like how I got trained in pain medicine and then I switched into this field. So I'll give you a brief about my journey in the next slides, maybe I'll be able to give you some insights of how you can incorporate AI into your day-to-day practice, as well as Dr. Sweety said, into the research. There's a lot of scope. Of course, a lot of things are the gaps are existing, and we have an opportunity. I would say we have an opportunity to be able to fill those gaps. Okay, so I come from this small town in western part of India, which is not so small anymore. I think it's quite famous now because of various marriages happening. This is Udaipur, Rajasthan, my hometown. And this you can see the Lake Palace in white color. And this is a very beautiful place. And that is one of the reasons why, again, people ask me, when you're working in AI, why are you living in Udaipur? So it's so beautiful, I cannot leave it. So I travel from here. I travel a lot. Almost every week I'm traveling, but I like to stay here. So this has been my journey. It all started in 2021 when this was post-COVID times, and there was a lot of discussions around future of healthcare, because we realized that there are a lot of gaps in the current form of healthcare that we are delivering. So I returned back to India from Dubai in 2021, and that was the time when India was hosting G20. And I got an invitation to AIIMS Rishikesh, and you can see me sitting here, and this is where we were discussing. And AI was a very new topic. There was no generative AI kind of landscape as we have right now. And you can see the date, it is just 2023. I started working. I have my own kind of brands like MedAI Capsule, MedUpgrade Labs. So I started doing my own work. Then I attached to some organizations like BrainX. This is from Cleveland Clinic, and IHMR startups. So I work in collaboration with a lot of organizations. I have been a LinkedIn top voice. I have been quoted in Forbes magazine, and this has been my journey to the Times Square. So this is where I was able to take this message that all healthcare professionals should be AI ready and future ready. So this was the message. I have undergone Google certification. So why I'm telling you all this is because you all must be wondering how a pain physician, what authority do I have to be speaking about AI in front of you? So this is my way of gaining trust before I begin. I have been teaching a lot all across the country, online in-person workshops. So the left one you can see, this is in INHS Ashwini in Mumbai. And the right one is I got an award for healthcare training in AI. Similar awards. This is our NMC chairman, Dr. Abhijah Sheth, for those of you who know him. And I was a faculty in the National Board of Exams AI course. This has just recently completed, and I think many of you must have been part of the cohort. And they're planning a much improved second batch soon. So those of you who have not done it, you can enroll in that. This is our in-person cohort, which runs in Geo Institute in Navi Mumbai. This is a executive education program of 3 days. And here we completely talk about AI in healthcare for 3 days, even over the lunch, tea breaks, everything is about AI. And if some of you are interested, I would encourage you to explore. We have the next batch coming up in, I guess, August. So there's still time, so you can explore this. I was also fortunate to be featured at the India AI Summit, which happened in February this year in Bharat Mandapam. And this is from there. So I have been working a lot. I have been creating content around it a lot. This is from my newsletter, which is the MedAI capsule. And you can subscribe to this newsletter after the webinar if you have not. And every month I try to come out with an edition where I try to update you. I try to teach you about a topic in simple language related to AI. And then I give you some research updates, some news updates, what courses to do, what events to attend. So it's kind of a monthly update, which you can see. And the link I'll be giving you in the last slide. So a disclosure, AI has been used in any presentation that I make. I use some kind of AI, although this presentation is mostly done manually. So this is in good faith. Okay, so now let's get started, and let me see how many people. Okay, 60 people have joined, which is a good number. So I would ask all of you to please scan this QR code. If you are attending from your mobile phone, then you go to your browser and you type slido.com and you put this number in your Slido, and you will be able to answer this question. And once you start answering, we'll be seeing the answers on the screen live. So what is the first word that comes to your mind when you hear about AI? So this is just a starting thing. I want to know what you feel when you think about AI. You might be an expert in AI, you might be a beginner in AI, or you might be an AI skeptic. It's okay. We medical professionals are trained to be intelligent skeptics about any kind of technology. But yeah, what do you feel? Okay. So I can see people are typing. So the more you participate, the more people participate, the more you will enjoy this session. It's not going to be a monologue where I come and I just lecture about AI and the future of healthcare, and that's it. So yeah, fast, future, computer language. Okay. Excited, smart, easy to detect and work safe. Okay. But most of you, the emerging theme is coming out to be future, which is quite true. So there are some innovative answers also, like artificial brain, silicon intelligence, nice. Cortical transplant. Nice. So I can see that most of the people here are optimistic, which is not the usual case in most places where I go. They usually have some words even on the other side of the spectrum, but it's okay. I appreciate your participation, and now I think you also can see what we all pain physicians feel about AI. ISSP is the national body of India, which is the biggest pain physician organization, and this is what ISSP in a way thinks about AI in healthcare, that AI is going to be the future in pain medicine. It's going to make us fast. It is going to make us smarter. And definitely computers are going to have a big role in this. So, okay, thank you for participating. One more question. I want to know, okay, you are excited about AI, but have you ever used AI? What is your experience with AI? Have you used tools like ChatGPT, Gemini? Have you used AI for making presentations? Uh, have you used AI tools which are non-generative AI, like the old AI tools, which used to classify the patients or give you a prediction, clinical decision support systems? Have you used some kind of AI? Okay. So most of you have been using it for presentations, email, or research, I think post 2023, 2022, 2023. And I have been reading about AI from 2019. So that is the time when this using AI for presentations and all was non-existent. We didn't used to talk about it also. Okay, so let me see in the chat. Okay, Dr. Venu Gopal says computer language. Okay, you can keep writing in the chat also. It's totally fine. I'll be having a look at the chat in between. So you can see that most people are using it already for presentations, email, or research. So 65% of the people who have answered, and I think this will extrapolate to the entire audience, that 65% people actually are using AI already. It's not something which is so futuristic or something which is not in our reach. This was the case before 2023, but after ChatGPT was launched, Gemini was launched, now these AI tools are very common. Okay. And I have seen this also, that 4% people have never used AI. So that is the reason why we are having such kind of sessions, so that all of us at least reach a basic level of understanding around AI. I'm not going to make you an AI expert in this 1 hour, but I'll take you to a basic level where you all will reach at least this level where you will be able to use AI for these tasks. And this 65% will go to 65, 43%, this will go to 100%. Okay, so that is my goal for today. Yeah, so Dr. Milan says in the chat, used for documents, creators, PPT, Excel. Very, very nice. So this is the generative AI part of AI that you are using. And today I will tell you that generative AI is not the entire AI. Means generative AI is a type of AI, but all AI is not generative AI. And this you will be very clear. And I'll give you some research pathways also, like how you can use other kinds of AI in different kinds of things, and not just generative AI. This is just one part, just like maybe 10% of AI, which is very popular nowadays. Okay, so let's see. So if you go online and search about the definition of AI, I'm not sure how many of you have done it. So you must have seen there are a lot of definitions, and all of them are correct, and none of them is complete. So that is the usual problem. But I developed this understanding by learning about AI over 7-8 years, that AI is nothing but just a way to move up this pyramid. You can see this pyramid, there's a layer of data in the bottom. Then as you move up the pyramid, you start going into information, knowledge, and wisdom. So the same data is converted as you move up each layer, and ultimately you are able to achieve something with your by data becoming your wisdom. And this is also natural intelligence. This is how we do it, right? We see patients, we gather data, and then we look at some lab reports, we look at some kind of MRI, we make it an information, then we apply our learned knowledge from the books, from journals, from our patient experience, we add it, and then that becomes our knowledge, and finally we act upon it, and that is when it becomes wisdom, and our patient gets benefit out of our wisdom. So if a machine is trying to do this, then it is called artificial intelligence, and the ability to do this is called intelligence, and the process of doing this, of moving up this pyramid, is called learning. So if a human is learning, it is called human learning. If a machine is learning, it's called machine learning. So now if you hear these terms, for those 4% especially who have never heard about AI or never used AI, if you hear this jargon like, the jargon like AI, machine learning, so now you know what it means. Okay, just remember this image. Then a second image, which is very important, is this one. And what this means is, now it will be clear what I meant, that AI is a very broad field. It is something like medicine, okay? Medicine, and within medicine, there's something called anesthesia. And maybe after doing anesthesia, many people go into pain medicine. This is one of the relations how I want to show you. So this is, as we go deeper, this is the relation between AI, machine learning, deep learning. So machine learning is a type of AI. It's not the only type of AI. There are many other ways of building AI. And AI is something which I explained to you with this diagram. So there are many different ways. One of the ways is machine learning, where you give a lot of examples, like Dr. Sweety mentioned fibromyalgia. So you give the data of fibromyalgia patients, you give data of millions of patients, and then you give the labels that this patient is fibromyalgia, this patient is not fibromyalgia. And then the machine learns the patterns inside that data, and then it makes a prediction on the next patient that whether this patient is fibromyalgia or it is not fibromyalgia. This is one type of classification problem. But now what has happened with the advances in machine learning, now machines can even be fed with X-ray images, CT scans, MRIs, photos, audio, everything. So complex kind of data, not just tabular data. So now you can feed multimodal data, and this becomes a deep learning. So deep learning is nothing but an advanced form of machine learning. So, and also it has a temporal relation. So this deep learning came into picture after 2010, 2012. Machine learning was there from 1990s, and AI as a field has been there from 1950s. So this is how you can now understand this is advancing. As it is advancing, it is going deeper. So this is one thing. And if some of you who asked me how is deep learning and how does it look, so it looks like this. And you cannot, a human brain cannot understand what is happening here. The data is entering from one side. This might be pixels of a photograph, and then in the end, this yellow is the output layer, and here where you get the diagnosis or you get the out. And what happens in between, it's very difficult to understand. These layers are all connected, and this is all data. This all data is shown as lines, and this data is moving from the input layer to the output layer, and something is happening in between. These are all like neurons. This is also called a neural network. And this is like inspired by human brain. I would not say it is exactly like human brain, but inspired by human brain, where each layer passes data to the next layer by applying some mathematical algorithms. The power of this one is over our human brain is that it can work without getting fatigued. Of course, it uses a lot of energy, but then it can work 24/7. And patterns which are invisible to us are visible to the machine. This is how it works and how it has an advantage over us, and how we can combine it with our intelligence to make human plus AI intelligence. And I would say that now it's time to go beneath the surface. We have been practicing evidence-based medicine, which is like we make groups and then we give intervention and then we see, okay, this is working in this group. But even within that group, it doesn't work uniformly, right? The intervention, it works in some very well, it doesn't work well in some, but we take an average. So we need to go into the below the surface, which is intelligence-based medicine. And now with technologies like deep learning, the data which we have collected now becomes a food for this, and we are able to now convert even this intelligence-based medicine into better patient outcomes. So now the future of medicine, any medicine, like even pain medicine, it's not going to be entirely evidence-based medicine. It will also be having a huge component of intelligence-based medicine. And this is what future pain physicians are going to be practicing in times to come. So yeah, if you have any questions or any thoughts, you can put in the chat. We'll be taking them towards the end of the webinar. Yeah, is there any stepwise way to learn AI? Yeah, I'll be answering that in the Q&A, because many of you will be having that question. I'll be giving you some avenues to learn further. This 1 hour is just like, means it's a introduction, right? It's not going to be the entire AI. I've been learning it for 8 years and I'm still learning it. So AI, in summary, it helps you to see what you have been missing. It just acts like a spectacle for a person like me who is myopic and I cannot see far. So I put a specs and now I can see what I was not able to see. So this is the role of AI that is going to be for us. Okay, so from this understanding, what I gave you this foundation, and I went slow for a purpose because this is the foundation. Now, the next slides which I show you, you will relate with them more because you are pain clinicians. But this much, whatever you have understood, if your pain clinic could use AI tomorrow for one thing, what you would choose? This is an open question. You can type your answer. It can be 1 line, 2 lines. So meanwhile, I'll have some water. So Sanjay sir, I'll be showing that. I'll be showing Notebook LM. Although I'll not be showing it live, I'll show you a notebook created by me today, and I have made a podcast in that. So some people are answering in the chat, compiling of all patient data, documentation, okay, to find out rare diseases among common percentage. So phenotyping, like, so you want to do clustering and you want to do phenotyping. So maybe all back pain patients are not the same, or all facet pain patients are not the same. They are having different phenotypes. So maybe identifying those phenotypes can be one of the application areas of AI. Yes. So definitely saving time for patients. Yeah, okay. You can reduce wait times. You can reduce the bottlenecks. You can take history. I'll show you a tool, and that will help you take history by just speaking. And it will make all the notes. It will help you do differential diagnosis, root cause, diagnosing pain generator, finding out overlapping symptoms, saving data of patients, advertisement to know the pattern for history taking, patient management, needle precision. Okay, that is something which has an added on robotics to it, workflows. Okay, so it's mostly about patient and mostly about data. So these are the two keywords in whatever you guys are mentioning. Okay, so many of these applications we'll be seeing today in the hands-on demo. Some of these I'll tell you how to learn, and I'll give you some other pathways where you can come and learn about it. But yeah, really nice answers, and I'm very happy to see that you are thinking in a very rational way about AI. Okay, so this is kind of a review. It's a recent review, and Dr. Sweety mentioned European guys are doing a lot of work in this, and this is from the European Journal of Pain. And these are the different areas where they have seen application of AI. And by this AI, we don't mean ChatGPT, Gemini, and only that kind of AI. We mean the AI which is machine learning also. That level of AI, we can use it for two things basically. See, AI anywhere, the old AI, it was used for two things, either classification or prediction. So if you want to predict the response to a dose or to a medicine, then you can use AI. Of course, you have to feed the data of so many patients and then find out patterns, and then it will be able to predict. And the more data, the more high quality data you put in, the better prediction it will be. But yes, this is an application. Then acute pain prediction. You predict pain before it happens. That is something which you can do using AI. Opioid misuse prediction, which patient is more liable to misuse opioids. That is something which you can predict. And also you can do real-time treatment tailoring. So precision medicine or individualized medicine, where you give a lot of context of that particular patient, and then AI gives you a personalized treatment plan. That is also possible. Similar to acute pain, chronic pain prediction, then you can do all these self-management applications. And nowadays you'll be seeing in ultrasound machines also, there's something called AI added on functionality where it can predict your needle path. It can color different tissues in different colors so that you can identify what is a nerve, what is a vein, what is a muscle. All that is possible. It's very good for teaching also. So overall, this is the landscape of how AI can be applied to AI in healthcare, how it is being already applied. These are already research studies which are happening. So these are the number of studies which are mentioned in that review. So it's already there. Okay, this is not something which we are talking about the future. It might not be available for us at this point of time, or maybe for some of us in remote parts, but definitely this is how it will progress for all of us. Yeah. Okay. So let's see, and let's move fast so that we can move to the hands-on demo part. You all are pain physicians, you all know about all these things. So I'll just take you through this, that we all see MRIs, X-rays, CT scans, and sometimes you don't have like decision time. If you can say we need short decision times, crowded clinic, or maybe we have seen something, but we have missed something. So that is one area. Or for triaging different kinds of patients. So not all MRIs need equal attention. Some MRIs need more attention, and most of the MRIs are normal. So that kind of triaging is also there. So what AI can do is AI can add objectivity. So objectivity means that you might see it as a disc bulge. I might see it as a disc bulge, but then both of our subjectivity will be different. You might take it as a different kind of a disc bulge. I will take it as a different kind of a disease. So, but objectivity can be added on with the use of AI, and you'll see it in the next slide. Second is speed to imaging. It can be added, and all these are foundation pain diagnosis. So this is how you add objectivity. So an MRI image. So they added so many MRI images. They took like millions of images, and then they added it to an AI model. They trained the AI model. And now what that model can do is it can automatically segment the different areas in the MRIs. So this is not done by humans. This is done by a AI model, which is a segmentation model. It is done by machine. Of course, when they gave examples to the training model before the model got trained, definitely humans did this on a lot of MRIs. That is called annotation. And once we fed the annotated images, now the machine is able to do it with fair bit of accuracy. So now we have reduced our effort in segmenting the different structures. So this is how it can help us in achieving speed. This is another example where nowadays you must be seeing in MRIs is auto numbering. So before the radiologist used to number manually in the machine. They used to write L1, L2, L3 or move those labels. But nowadays it can be labeled automatically. So this is another application area. Then especially in the axial scans where you want to kind of grade the compression which is happening. So this is an area where there's need of objectivity. And this is how you can add objectivity with the use of AI. So this AI gives kind of a metric. It classifies and gives kind of a metric. This is a regression algorithm. So regression algorithm gives you a number between like 0 to 100 kind of a number. So that adds kind of objectivity. And this is better for doing research. So if you're kind of operating on patients and if you are using this kind of a regressor to at least triage your patients or to select your patients, I think this is a better way to do it. And also outcomes can be fed into this model that this patient, which we did intervention, this patient had a good outcome, this patient had a bad outcome. And then that model can predict, okay, when you give it an MRI, it can do the segmentation, it can do the objectification, and then it can give you a probability that the probability of this patient achieving results or pain relief with this kind of an intervention is this much. So that is what I'm talking about. Then again, another example that was MRI CTs. This is something which we see in our clinics. So many of the pain physicians who are seniors here, they can tell from the face of the patient that the patient is in pain or not. And how that happens, our human brain gets trained with time as we see more and more patients. Or you can also train a vision algorithm. The camera sees the patient facial features and it learns with time that, okay, this patient, if he makes face like this, it means pain. If he's smiling, it doesn't mean pain. So all that kind of rules get fed in. And then you also give your feedback. You ask the patient also, you add that the pain score also as an input. And then you can train an algorithm which can tell you with fair bit of accuracy. And this is very useful, especially in patients who cannot speak or who cannot tell you that they are in pain. So this is some kind of tool which you can build on normal patients and then use for patients who cannot express pain. Okay, this is one another area application of AI. And now with so many things, you are wearing smartwatch, you are having so many wearables. There are so many sensors in our hospital, in our room, in our clinic, which is called ambient AI. So you can even record the voice of the patient and see even the voice can say that how much pain the patient is in. We as humans may not be able to find out those subtle patterns, but AI can definitely do that. And it can help you in detection of pain as well as in grading the intensity of pain in a better, more objective manner. That is now becoming possible. And all these are recent papers taken from like good journals, and they're already being applied. Maybe not in our part of the world, but definitely this is happening, and this will definitely percolate into our part of the world with time. It's just a matter of time. Then I told you predicting which patient. So same this example, which I already explained to you. So you can feed the patient profile into AI, and it can predict that which kind of treatment is recommended. Of course, you are going to choose ultimately and perform it. I'm not saying AI is going to do it, and even if AI is going to do it, definitely it's not going to take the responsibility of it. So you have to use it as a support tool, clinical decision support system. And definitely it has a lot of context, maybe something that we have missed, maybe it has been included into that model, and these models have to be very explainable to be able to give us a good adoption. Because if they just tell me that please do a nerve block and it doesn't explain me why, then I'm not going to do it as a smart pain physician, because ultimately I am responsible. So this is something which is another application area. So instead of trial and error medicine, we can now move into kind of a more predictive model. And again, I told you, now we have so many kind of inputs. Every patient is having a mobile phone nowadays. They are having smartwatches, especially in metro cities for sure. So they can capture lifestyle factors. They can you can also have some advanced tests like genomics and all. So you can have some biomarkers, pain biomarkers, and everything you can combine. So now the AI has become multimodal. It is no longer you feed text, it gives out text. That was ChatGPT version 1. But now you can feed images, you can feed ECG, you can feed their voice, you can feed their symptoms, you can feed your own context, your own assessment, and you can get kind of a individualized, personalized report or a recommendation, which you can even convert it to an app. It's quite possible. And finally, when you are performing procedure to the patient, this is what I was mentioning. Nowadays, there are smart ultrasound machines which even guide you how to place the probe and how much to tilt, how much pressure to put in real time by voice. I've seen those machines. I have used them in Middle East, and this was there, I think, 5 years back. So now they must have improved a lot. So this is another area. Okay. Okay, that was on last. This is the last one. So now we have something called guided physiotherapy also. So for patients who cannot have a good compliance coming for physiotherapy, now there's something called AI assisted physiotherapy. This is not the only one, and I'm not promoting any brand here. There are many other startups also working in this space, and they are trying to create body points connections and more accuracy they are trying to bring. Along with the human physiotherapy guidance, which is available on the app. So it is not entirely AI which is going to guide you. It's going to be a human plus AI kind of a combination, and you don't have to move too much away from your home. You can do it anywhere in virtual setting. So this is another thing. Okay, so now let's move to the actual AI which you people have been exposed to now so much with news headlines, with so many kind of ChatGPT, Gemini, OpenAI, Anthropic wars happening in media, all those things. And you must have noticed it suddenly increased after 2022, 2023. So what really happened? This happened. We were seeing this image. So you must recognize this now. This is the whole field. Green field is AI. This blue field, light blue, is machine learning. Within that, we were very happy with deep learning. We were exploring applications of deep learning. As I showed you till now, these all were applications of deep learning. But then suddenly OpenAI came out with something called ChatGPT, and we entered into a fourth circle, which is generative AI. Now, how this generative AI is different from other AIs is now it can generate content. It can create a report. It can create an image. It can create an X-ray. It can create an MRI. So before, what you were doing, you were trying to classify whether this is pneumonia or not a pneumonia. But now you can generate a synthetic X-ray to teach your students that this is how pneumonia looks. So this has been the shift. And what happened is the entire world moves towards something which is very shiny, which is like very new. So this generative AI is the most newest child on the block and family's favorite. So this is only a small part of AI which is becoming very, very popular. Of course, it has a lot of applications and lot of these softwares are being developed in different areas for this kind of generative AI. And we'll be seeing some of them now and how we can use them, because you have to move with the world, right? You have to be accustomed to what is happening. So we'll see a few use cases, but now we are moving only into generative AI. Now, from this point onwards, whatever we'll discuss is only about generative AI. Any questions till now? So as you can see, there are so many applications of AI. You can put in the chat. I'm seeing the chat. Dr. Mansa says, kindly give insight on wearable sensors too, sir. So this is a different kind of a topic. You can connect with me. I'll be happy to help you offline. Venugopalan Rao, he says, kindly add the role of AI in pain education resident. Yeah, we'll be seeing a use case around it. Dr. Tejas says, is the AI tool supposed to have a license of software as a medical device? Yeah, we'll be talking about that in the ethics part in the end. I'll be giving you some kind of guidance. Of course, it's not something which is cast in stone, but yeah, you can use that. I'll also share some things with the team post the webinar, a few papers where it guides you to whether use the AI recommendation or not. How you should judge about it. Kinshuki Jan says legal issues with audio and video monitoring recording of patients. Yeah, so legal issues, same like having legal issues with anything that you are doing. Like if you have some kind of an outsider in your OT or in your pain procedure room, whom the patient doesn't consent to be there, then you should not do that. So many operation theaters in US and Middle East, they don't allow observerships because the patients don't allow observer being present in the OT. So this is an observer. Of course, it is HIPAA compliant, it's GDPR compliant. So whatever gets recorded gets deleted within 10-15 minutes or so. This you have to also ask your tool provider that is it HIPAA compliant, is it DPDP compliant, is it GDPR compliant, are you storing the data, how much time you are storing it, what you are using it for. Once you are confirmed about that tool, then you use it and you inform your patient. Of course, you have to inform your patient. You have to tell them that I'll be scribing what am I speaking. Are you okay with that? If they are not okay, then you should not use it. Dr. Sanjay says how to know that AI. Yes, sir. There are methods to that. Again, I cannot cover it all in this small webinar. I do it in in-person workshops. We do a lot of use cases and we make you do it. And then you tell us how you get the correct answer. But of course, better prompting. If you are doing good prompting, using a proper tool for the proper use case, and you have to verify. You have to be the human in the loop. You have to stack multiple AI tools sometimes to verify, like verifying the answer of one AI with another kind of better AI which uses some kind of a RAG system. So all those things are there. So bit technical, but yeah, you should always be skeptical of the answer, of course, especially numbers, doses, all those things, citations. You should always take them with a pinch of salt, not copy paste. Okay, let's move ahead. So now what happens is with generative AI, now you can also educate your patients, you can educate your students, you can educate yourself, and you can also support research. You can do many other tasks, workflow tasks in your day-to-day practice. And now let us see some of them without wasting any time. I'll stop sharing and I'll reshare my full screen so that I can move into the browser. And this is now something which you can do from tomorrow if you have not been doing it. And if you have been doing it, then you can please mention in the chat how we can do it better so that we all learn together. So let me share my full screen and let me share my browser. Okay, so I have prepared kind of demos. So I have prepared 4 or 5 demos and let us see how much time we have. I will try to cover all of them in this one. There will be some tools like Perplexity, then Glass Health, then there will be ChatGPT and Notebook LM, and we'll see some exciting things also. But let's see, let's move to the first one. So there's a tool called Perplexity. Now, Perplexity was very popular initially because this was the only tool which was kind of working like Google, but kind of an AI. So it was giving you sources. It was telling you from where it has taken that information, which ChatGPT and other tools were not giving at that point of time. But I would say even now, this is fairly more accurate than those tools in giving you the source and evidence-based information. So whenever you are looking to check any guidelines or you are looking for any fact checking at the bedside in your clinic, I would say this should be the first tool that you should go to as a clinician. If you are not using any other specialized clinical AI tool, again, if you are using something like Open Evidence or UpToDate or some other tool, I think those are more suitable for your clinical kind of a practice. Although there have been studies that those tools are not as good as these general purpose tools, but there's a way of using these tools, of course. But I would say if you're not using anything right now, Perplexity is a free tool. This Pro it is showing because I have a Pro version. I have bought it. I got it with the Airtel SIM. Now that scheme has gone, so you have to buy to get a Pro, but free one is also good enough. So what is the use case? What is the use case if you want to, suppose you have a low back pain patient in your clinic? It might be any other condition, maybe a rare condition which you want to check guidelines on. Just taking an example. So I can just simply write like I used to write in Google search. I can just put in this search box, I can say latest low back pain treatment guidelines, key recommendations with sources, and I'm looking for an interventional pain management focus. So a simple prompt. Again, this session is not about teaching you prompting. There's an entire workshop on that. But the better you write the prompt, the more details you give, usually you get a better output with common tools. Again, if it's a reasoning model, it's a more advanced model, which most of them are. So even a single prompt like this, only 1 or 2 lines, this also gives a good enough response now. The advantages of Perplexity, now you can choose sources. So if you see there's a plus button here, you click this plus button, you go to connectors, and then you choose academic papers and deselect web. I don't want this to hallucinate. So Sanjay sir, answer to your question, how do you reduce hallucination? This is one of the ways. You go to the correct tool, which is Perplexity, and then you choose the correct sources. I am not choosing web because I know there are many articles written by these influencers, healthcare influencers. And then what will happen is my tool will get confused and it will pick up information from there also. And of course, it will pick up from Cleveland Clinic website also, Mayo Clinic website also, but then it will also pick up from some Ayurvedic kind of a background or some kind of nothing against Ayush, but then it is not the guideline. So I want guidelines for interventional pain management, then I have to look for academic kind of a paper sources, so that then what is the difference between me and my patient, right? So this is going to be the difference. And also I can choose models here, I can choose different models. So one tool, I can choose different models within the same tool, but let us choose the best. So model cell chooses, and I simply click here. And now you will see that this is a thinking model. So the most of the modern models, they are actually telling you what they are doing. So this is kind of explainability. They are searching the web. Now it is looking for, it did these 4 steps to get to your answer. And you can even go in detail which source it went to, and you can even check out these websites. Like this is a BMJ website, which it has used and which it has gone to. So all these things you can verify, cross verify, and it becomes easy to verify. And this gives an answer. So it gives you an answer which you can read in a small amount of time. It's kind of synthesized for you as a clinician. And you can also ask follow-up questions. So now you can say, can you focus the algorithm on facet joint pain specifically? So you can keep having a conversation with the tool. But of course, you can do fact checking also. So suppose my colleague told me that we should advise bed rest to all patients. So I don't know. I'm a learner. I've just joined the fellowship and I don't know. So I will ask, is it correct that all back pain patients should take bed rest? Verify with guideline references. So again, I can fact check things. Maybe my professor told me something, then I can fact check it. So maybe my patient told me something that they saw this somewhere. I can fact check it. So it says, no, the current guidelines do not recommend bed rest. And it is also giving the source. So I can check from where it took this answer. So this is something which is less prone to hallucination. Again, this can also hallucinate because this is also based on the same technology, but chances are less. Okay. So this is one thing. Second, I want to show you something which is called deep research. So suppose you are, now there was a question in the chat, I am preparing a chapter or I'm preparing kind of a PowerPoint presentation for my students. So you will do research, right? You will start from research. Anything you do, even if you create a social media post, you have to start from research. So you come to this tool and there's something called deep research. So how this is different from search, this goes more deep and it gives you a more detailed report, which you can download as a PDF and you can then use it in a different way. You can upload to Notebook LM, create an infographic, all those things you can do. But deep research is a more deeper way of doing research. And suppose I put this prompt, provide a deep overview of trigeminal neuralgia. I want the definition, pathophysiology, diagnosis, conservative and interventional management, and recent the entire chapter. And again, I choose this academic. Please don't forget this. There might be some places where you want to use the internet. Maybe you want to make a social media post where you want to address patient questions. So there you have to go to see what people are talking about. But right now I want to teach my students, so I want only academic sources. Again, I click on this. For a free version, you get, I think, 4 or 5 deep researches per day. For a pro version, you can use unlimited. It takes a bit of more time than the normal search, and it is going to go to more sources, many more sources. And what sources it is going, you can see in the links. So all these sites it is going, you can go and check. BMJ trigeminal neuralgia practical guide, it has taken something from here. Everything is verifiable, cross-checkable. So this is the first app or first tool which should be installed in your phone. Okay, so it is thinking, it is doing all those steps. You can see it is collecting insights from every step, and then in the end, it will generate a report. It will convert it into a nice report. So let us see it. I want to give you a realistic feel of how it feels. I could have shown you completed version, but then you will think that this is magic, but this is how it works. So those of you 4% who have never used AI, please start with this one. It's a very easy use case, common one. Don't select 10 use cases. Select one use case in your daily life, which is practical and you can use AI on. And yeah. And again, having said all this, this doesn't replace your clinical wisdom. Please take every information and please verify it, check it. Most of the times you are the expert, you will know about it. And that is why AI is very good in the hands of experts. But this is going to help you get the information in a fast way and at the point of care. This is something which it is helping. So this is the kind of report that it generates. See, it has given such a detailed report to me. And now what I can do is I can still writing. It's still writing. I can download it as a PDF when it is complete. See, so I can download it from this button. I can download it as a PDF. These are the 32 sources that it has used to generate this report. And now what I do with this report is up to me. Now, suppose I want to convert this into a structured outline for my talk for my students. So I simply ask it here, ask a follow-up. It is telling you to ask a follow-up. Just ask a follow-up. Now convert this into a structured teaching outline for a 30-minute talk to medical students. Now this can be to your patients also. So, and it can be in Hindi also. So you will mention all that in the prompt. But whatever output it gives, it is your responsibility to at least read it once, check it, not just copy and paste it as it is. Okay. So this is how it has made the session overview, learning objectives it has given me. So if I'm preparing kind of a brochure, I can use all this. Clinical vision. This is also giving me a clinical case which I can start with my class. Of course, I can modify all this and I can make some fine changes, which I always do. Pathophysiology, diagnosis and workup. So it has given me an entire structure for my talk. So this was the first demo. So did any of you get an idea? Those of you who are not using at all, is this something useful for you? If yes, you can write a yes in the chat. So Dr. Vivek says, can we interlink devices with AI? We'll talk about this in Q&A. Dr. Arpita says something about augmented intelligence versus artificial. It's a philosophical debate, Dr. Arpita. We can go on and on. I think everything is augmentative only, no? Our laptop, my laptop I'm using to connect with you, it's augmenting my ability to reach out to you. Sanjay sir, can AI help in downloading a paid article? I would again say it's on the ethical boundary, but there are tools you can Google and use some of them. I cannot stop anyone, but yeah, better to pay and then use it. Okay, so yes. Okay, so let's move to the second demo. I guess now most of you on this call can go tomorrow and use Perplexity. You can invent your own use case where you can use Perplexity now that you know how it works. And then you can share with your peers and colleagues how you were able to do it. Dr. Ambika says, yes, it's definitely helping, yeah. Trying to understand. Dr. Manisha says, maybe once I start, yeah, and you will get a recording. So you can go through the recording again. And if you have any doubts, you can reach out to me on LinkedIn. I'm out there, so I can help you. Let's move to demo 2. So this is one tool which is called Glass Health. And please don't assume that I'm promoting Glass Health. I have no connection to this brand. I'm just showing you one clinical decision support tool which has an ambient scribe. Scribe means whatever I talk, it can convert into text. And also it can help in making a differential diagnosis. It can help in generating documentation. Some people mentioned the chat documentation. So this is one of those tools. You can use Gemini ChatGPT also, but this is a specialized tool built for this purpose. And the founders of this company are doctors themselves. So they understand how doctors think and how they work. And this is mainly built for the Western kind of a setup where they have electronic medical records. To contextualize this in Indian setup, there are some Indian companies working on this. You can find out many of their products are coming up now. One of them is, I guess, Educator. They have a EMR with such kind of a tool built in. But this is one tool which I will show you, and this learning applies to everything. So can any of you volunteer to give me a patient history, short patient history, single paragraph, 3 to 4 lines, 5 lines? Will you be able to do it? Will you be able to speak, unmute and speak? So you go to Google, you type Glass Health, and then you sign up. And this is a freemium kind of a thing. If you want to buy the full functionality, you have to upgrade it. If you like it and you are using it to even to educate your students, it's a very good tool. You can buy it. So what you do is you simply go to this tool and you start scribing, and it starts listening to you, and it does it in real time. So let me do and show it to you. So that will be easier. I have prepared a small patient history. Let me just read it out and let's see what this tool does. Okay, so I'll push start scribing and I'll start speaking. A 54-year-old man presents with an 8-week history of low back pain radiating to the right buttock, a posterior thigh, lateral calf, and dorsum of the foot. The pain began after lifting a heavy object and is worse with sitting, bending, and cuffing. He also reports numbness over the dorsum of the right foot and mild weakness while climbing stairs. He denies fever, weight loss, trauma, bowel or bladder symptoms, or saddle anesthesia. His medical history includes type 2 diabetes and hypertension. Examination shows a positive right straight leg raise, mild weakness of right ankle dorsiflexion, and grade 2 extension, and reduced sensation in the L5 dermatome. MRI demonstrates a right L4, L5 paracentral disc extrusion compressing the right L5 nerve root. So as it was listening, you can see it has already started populating whatever I am speaking. This is called scribing. And once I end the session, now I can ask it to either make a note for me, draft a HNP note, history and physical examination note, or it can draft a differential diagnosis. So let us see differential diagnosis. So now you can see this window. It is understanding my query. It has all the context which I have given. I can also attach MRIs. I can attach X-ray, CT scan, whatever. I can attach those in the paid version. And now it is giving me a differential diagnosis. So it is telling me the case discussion, most likely diagnosis it is giving me, expanded differential, can't miss diagnosis. So see, and it is also giving me references from all medical sources. So this is kind of a specialized tool built for this purpose. And it's also asking me, would you like to draft an assessment and plan next? So this is a very good tool, even if you're not using on real patients, to teach your fellows that okay, how to approach a patient, of low back pain coming with such a history. And you can do this with them real time in the class. So this is something which would be like innovative teaching. And you'll find as you use more, it will make some mistakes. And that is where your expertise comes in as a teacher. And so you can keep on doing this. So simply you have to tell, okay, and just to save time, I am doing it. Draft assessment and plan, or there are many other options like draft a progress note, draft discharge instructions, patient handout. Suppose I do a patient handout. Let us see what it does. So this is second demo, this is second tool. So after this webinar tomorrow, please go and explore this tool on your own. Try to do whatever you can with this free version. So this is another AI tool which I am telling you. Perplexity. Second is Glass Health. Okay, so see, it has given me patient handout. So patient handout is in form of question answers because patient wants to know very specific information. Okay, so how many of you were knowing about this before? If not, then can you write no in the chat so that I know you learned something new? Okay, good. So it's nice to see that something new was discussed and you will be using this tomorrow itself. Good. Okay, so let's move to the next demo. Next demo is going to be about patient communication and education. This is also one of the common use cases for us pain clinicians because they are already coming from so many places, confused. Many kinds of information has already been given to them. Some of them are totally having that kind of depressive mindset that nothing can be done. So all those things, it becomes very difficult to communicate with the patient. And if you do that in their own language, in the way that they understand, it becomes better. So we'll now see a very common tool, which is again ChatGPT. Let us see how we can use it for patient communication. Of course, you can use Gemini and other tools also. And I would suggest use all the tools and then choose the best one which works for you. So suppose I have now a patient. This is a patient history which I've already prepared. And this is a knee osteoarthritis patient, and I'm planning to do a genicular nerve radiofrequency. And I want to explain all this to the patient in simple language. Or maybe I want to give this as a handout to my assistant in my clinic, who can then explain to the patient, sit with them, go through each point and explain to them. Yeah, anyone wants to speak? Okay, so you can mute yourself. We'll be taking Q&A. Just 10 minutes more and we'll move to the 10-15 minutes. We'll move to the Q&A in the last. So it's Dr. Sunita, it's Glass Health, HEALTH, Glass Health. And there are many more like this. So you go to Google and type Glass Health alternatives, and you'll get a list of AI scribes. And then you can also write Indian AI scribes. So you'll get a list of Indian AI scribes. Okay, so suppose I have done like this, and now I just click on this. So now, just to explain to you, this is a 67-year-old woman with chronic right knee pain for so many years. I've given the entire history, what I assessed, what is the examination, then what I'm planning, what is in the X-ray, everything I've put into it. Now I've asked it to make a patient information document in simple language. Then I can also explain what is simple. I can tell it to make for a 6th grade understanding, for a college student, for some kind of a school student, or an illiterate patient. I can mention all that. Then it will do it accordingly. It will simplify it according to that. So now you can see it has explained in a very simple language in form of question answers. And these are the common questions which patient has in their mind. And this is how you can do it fast. Some people mentioned fast in the first word cloud, which I showed you, Slido. So this is fast, okay? But again, this is not copy paste. You cannot copy and paste this. You should not, because you never know. It can hallucinate. It can make one single confident mistake and then it can create misunderstanding to your patient. So always read this, not once, maybe twice, but at least writing this, your time is reduced. So that time you can use in maybe just going through it once. Then suppose my patient doesn't know English. So what do they do? So here itself, I can tell it to translate it into Hindi, or I can translate it into any regional language also. But for that translation task, Gemini is a better tool because that has better training on language. But Gemini, this ChatGPT also does a fairly good job. It's Perplexity, you can also try this. So it is telling आपके घुटने की समस्या और उसके उपचार को सरल भाषा में समझे. मेरे घुटने में दर्द क्यों हो रहा है? So then it gives an answer in Hindi. Same thing, it has converted in Hindi. So you can create different language flyers for your clinic and keep them ready so that the most common condition patients, you can just hand it to them, and then you can tell an assistant, please sit with the patient and explain to them. And if you have any further questions, please come to me again. So this is something. And not just this, it can also make kind of a infographic for you. Now ChatGPT is becoming very good, and I can see already many physicians or society people are making flyers, event flyers using ChatGPT. It's a very good thing. It's not making that spelling mistakes now. So you can now tell it to create one page patient information infographic leaflet that I can give to this patient. So it will start creating an image, and it takes a bit of time, 1 minute, 2 minutes, but the quality is very good. It will also make the images of the knee, bones, everything, and it will also since now I've told it to do in Hindi, so I'm expecting the infographic will also be in Hindi. So let's see. And this makes the third demo. So first demo was checking evidence, fact checking, doing deep research, creating an outline for your presentation. Second demo was glass health, scribing, documentation, clinical decision support, differential diagnosis, teaching students. Third demo, patient communication, simplifying in their language, making an information leaflet. So these 3 demos we have covered. And so how many of you are satisfied and we can stop here? Or do you want to see 1 or 2 more demos? If you want to see 1 or 2 demos, just write a yes in the chat. Yeah, Dr. Arpita, you can use Grok. You want to see 2 more things? Or we keep it for next time? Okay, so I can see a lot of yeses. So, okay, so let me do that. We'll spend less time on the ethics part, which of course is important, but then you have to build it yourself. It's not going to be me telling you. So it's just creating this infographic. So this gives you a realistic idea how much time it takes to create one infographic. So see, this has created this nice infographic, and if I zoom it, so you can see this is like quite a professional one, right? Which we get from our marketing teams. They build it for us, and you can also add your logo and your clinic branding, and just add it here as a photo, and you can tell it to incorporate that into this flyer. So this is something which you can do tomorrow. All these 3 things which we saw, you can do today, tomorrow. You don't need to wait. But the other kind of AI which we saw in the first part of the session, you definitely need to do a lot of research work, collect data, build algorithms, be part of a laboratory. Your hospital should have a good R&D setup, EMR, of course, and then only you can be able to build that kind of AI, okay? AI models. So this is third demo. Let us see 2 more very fast. So to save time, I will show you already created things. So while I was preparing this talk, I already created something. So to save time, so there's something called Notebook LM. This is another tool which is free. It is from Google. So this is a tool where you can come and create a new notebook. And when you create a new notebook, you can type a topic. Suppose you are trying to learn about neuropathic pain, or you're trying to learn about any other topic, or you're trying to build slides out of it. You just put that topic. You can choose fast research or deep research depending on the time that you have, and depending on the level of depth you want to go. If you select deep research, it will take more time, but it will go into more deep research like we saw in Perplexity. So this is similar to that. Or you can even upload your PDF files. You can upload some YouTube videos, links, You can even copy paste. You can put some connect to your Google Drive, and you can import files from there. So to save time and to show you already one notebook I created, similar method, I went and I typed, I want to learn about diagnosis and treatment of neuropathic pain. And it gave me these sources. So every source I can check. It gives me a summary of the source. It gives me from where it has taken, and I can check it. I can click on this and check from where it has taken that information. So it has gone to IASP website. It has taken from there. So this is also something like Perplexity. It is something which is helping to reduce hallucination. Again, an answer to Sanjay sir's question, that how can you reduce hallucination? So this is another tool which can help you reduce hallucination, or at least identify them in a better way. So you can see there are so many sources. I can select some, I can deselect some, I can select all. Depending on that, whatever I type here, this is just a window. I can ask questions here. I can ask what are the most common causes and types of neuropathic pain, just like ChatGPT Gemini. Or I can create some things. I can create an audio podcast. I can create a slide deck. I can create a video, mind map. So there was a question in chat, how to create slide deck. You can use this tool to create a slide deck also. And I've already created some things to save time and show you. So let me show you this podcast. You try on your own, and you have to click on this button. Once you have done the sources, you just have to click on this button here in this studio. It will generate an audio. Or if you want to customize it, you can go inside and choose some options to customize it. Just try all these, try them out, and then you will get a better idea instead of me showing you. But let me show you some things. One is a video. So it creates a nice video. There will be an audio also, but I have not shared sound. So it creates a video like this, which is an explanatory video.
Need for specificity is most evident.
Okay, so let me do that so that you get an idea. Let me share with sound. Okay, so this is the video.
Standard acute pain is a nociceptive symptom,
You can hear the sound,
a temporary
please write
warning
yes.
signal that tissue is damaged. Neuropathic pain is different. It is an active, progressive disease of the somatosensory nervous system itself. It is a significant clinical burden today, with neuropathic pain affecting between 3 and 7.
So you can download this video from here and you can use it. You can create a YouTube channel. You can make some changes to this, and you can make or an educational material for your class for teaching your students. You can do that, or you can give it as a post or a pre-read kind of a thing. Second, this is the slide deck which gets created. So this slide deck, it has auto-selected many things. I don't have much control over this deck, but I can of course revise any slide. If I don't like any slide, I can click on this revise button and I can ask it to recreate something. Okay, that is quite possible. So this is the kind of slide deck which it creates, very detailed pathogenesis, then diagnostic matrix. So this has been created within 5 minutes. But then again, I don't have much control over it. So the better way is to get an outline from Perplexity, then use a tool like Gamma. That is another tool, GAMMA, and that does kind of a better job. And you can edit that. You can download it as a PPT and edit it in PowerPoint. But this one you won't be able to edit because this gets downloaded as an image. So you have to make changes here only. You have to ask what you want, and then it will make a change, just like AI, ChatGPT. Then let us see infographic. So this is a kind of infographic which this can create. So you can see this is the difference between ChatGPT and this one. So this you can choose landscape, portrait. So, and you can also create slides as infographics. I use this many times. I want to make an infographic out of a study and then incorporate it as a slide in my deck. That I do a lot. Then you can see there are flashcards. You can generate blog posts, flashcards. You can generate a quiz, and this quiz also you can share to your students, and they can, once they select, and they will get a score also. So this is another feature. So I would encourage you to use this tool, Notebook LM. It's a very vast tool, and it has an entire workshop can be done only on Notebook LM. But please do it yourself. Now you can get started, experiment, and it's free. It's not going to charge you money, and you can use it a lot for your own learning. purpose. So this is demo 4. Finally, demo 5. For the sake of time, let me just show you. I tried to do data analysis. So there's something in ChatGPT now, which is called, if you go to ChatGPT and you have this side window, you click on this side window, you go to more. In this more, you go to GPTs. In GPTs, there's something called by ChatGPT. These GPTs are custom GPT. They are nothing but a specialized form of ChatGPT. Like we are pain physicians, so we are a specialized kind of anesthetist or different branches. So that is an extra layer of specialization. So this is specialized for data analysis. So if I click on this and I can start a chat, I can upload my Excel sheet here, and I can start chatting with my Excel sheet, and I can make graphs. I can do data analysis. I can do some basic modeling also. But then again, this is not a replacement. It's a supplement, or you can try to do a fast data analysis with this and then do a deeper data analysis with proper tools like SPSS and Google Colab. But I'll show you one which I did. I had a Excel sheet, the synthetic data set created, which is like 500 patients of pain patients in my clinic. I just uploaded it into Excel, into this. I can also upload it as a Google Sheet in my Google Drive and then use it. So I told it analyze this data set and provide me a summary. So it gave me a summary what it is. So there are 500 patients. This is the mean age. This is the pain duration, and this was what different procedures were done. So what was the mean pain score before the procedure and after the procedure? And then it gives me some insights, clinical insights, that what this data tells me. Then I can also ask it for some more details, and then I can ask it to make some bar graphs, bar charts. So this is the kind of bar chart that it creates. So these were different procedures done, and these were the average 3-month pain scores for different procedures. So it created a visualization of data. And again, I told it to create a scatter plot between the pain duration and functional improvement. So there was no relation between the pain duration and functional improvement. So this was the analysis that it did, and it told me that the relationship between this is essentially absent in this synthetic data set. Pearson correlation coefficient it calculated and gave me, although it doesn't tell me the calculation, so I cannot verify it. But then here, sometimes it shows a Python coding while doing it. So that ways you can just cross check that is it applying the correct formulas or not. So that is a limitation of this tool. Finally, last thing, which I will end with, is creating a mini app for you in Gemini. So Gemini is very good for creating mini apps. This is another use case which you can try as a pain clinician. You want to create an app or a calculator for your clinic. So you can simply go to this and let me change my account. Oops. So the key is keep multiple Gmail IDs so that you can use multiple accounts on especially free things to experiment. So this is something which I created, pain procedure eligibility assistant. So suppose I have I want to have a tool which can help me decide whether I want to go ahead with a pain procedure in this patient or not. Not something very relevant for experienced pain clinicians, but maybe you want to protocolize it, or to maybe give your assistants, juniors in your team, that okay, this is how we should decide. So you create a prompt. This prompt you have to write what you want, which tool you want, what should be there in the tool. You have to sit on it. It is a document which you have to create. Maybe you can use help of AI for that, ChatGPT, and then you put it here in this Gemini, and it does the coding for you. So you don't need to know coding. I don't know any of this, what it has written, but it gives me a preview of my app, and I can share this app with anyone and get a feedback. Please don't share with patients, because these apps, again, a question in the chat was there, these apps need to be validated if they are being used for patient care, or you are giving it to your patient, because then you might land up in legal trouble. For internal communication in your team, or for internal use, your own personal use, to simplify some tasks for you. You can use these kind of calculators and tools. So this tool, for example, it takes patient information, how many years. So I can write maybe 30 years. I can choose female. I can choose whatever the diagnosis, and all this is customizable. I can make changes here. I can keep talking to it and make changes whatever I want. Pain duration, for example, 6 months. Pain score is 8. Pain type is nociceptive. Pain distribution is radicular. Functional impact, unable to do, unable to sleep disturbance, all those things is there. This all is customizable. Okay, this is don't think that this is what is only possible. Physiotherapy completed, home exercise program, medication, lifestyle, previous interventions, diagnostic injection, imaging is available. Imaging correlates with symptoms, no red flags are there. So let us see, evaluate the eligibility. So this is suitable candidate. And what are the supportive factors? If I would have added some red flag, it would have given areas requiring attention, suggested next steps, and it gives an assessment summary which I can print. So such kind of mini apps you can build. So with this, I think I'll end the demo. I've already overshot, and I'll just finish my few last slides. This is a workshop which I'm doing, me and my colleague co-faculty. So how many of you are from Delhi in this chat? Can you mention yes, or you can write a D. Are you from Delhi, NCR, or nearby area? Okay, so I can see there are a few people. So this is an event which we are doing on 4th of July in GIMS, Government Institute of Medical Sciences, Noida, Greater Noida. It's 40 kilometers from India Gate. And I'm going to be there in person, and my colleague, and we'll be taking you, if you like this demo of 20-30 minutes, this we are going to do for 9 hours on that day, from 9 o'clock to 6 o'clock. And we are going to do real use cases. We are going to interact in you are going to bring your laptop and do it with us, and the price is like dirt cheap because this is an inaugural batch and it's a government institute. So I would like those of you who are from Delhi NCR and you want to learn more and practice more hands-on and learn with me, you are welcome to enroll for this. It's not a very big price. I think more precious is your time. If you are free on 4th of July, I will be happy to interact with you and teach you more. So that's this one. So ethics, again, I told you, AI will never be responsible. It cannot be held responsible, at least in the present frameworks, unless we have autonomous AI, which we will have in times to come. And they will need to build some frameworks where how much responsibility is on AI and its builders or its operators, how much is on clinician. But till then, please be careful. Please use it responsibly. Some of the use cases, if I showed you and you feel that it's not ethical, please don't do it. Or I try to do it in an ethical way. Try to improve your data quality. If you're not collecting data in digital form, please start collecting data, because that will help you build AI down the line. And if you have bad data, then AI cannot fix that bad data. It will only amplify the bad data. So that is very, very important. Teach your fellows the importance of data. Then this is something which is quite, I would say, cliche. Then this is a future which I want to show you. So because many of you are running pain clinics, so the future of pain clinics is not going to be like it is now. It is going to be smart pain clinics where all these things will be integrated, like data, insight, action, and with humans in command. So this is kind of a futuristic vision which I want to give you. So, and this will differentiate your pain clinic from some other pain clinic. Okay, so last message, the future of pain care is human plus AI, compassion with computation. Technology will keep evolving, but I know the patient sitting across the table will always need an empathetic human first, but let us not take it as an excuse that there's no need for AI. It's definitely going to be human plus AI and neither alone. So let's start working towards that. You can take a screenshot of this last slide. If you want to connect with me post this webinar, I am happy to connect with you. This will take you to my social links. You can send me a connect request on LinkedIn. You can write to me an email. If you want to do the similar kind of an event like gyms in your city, I could see some people are from Mumbai, some people are from other places. So if you want to conduct such kind of an event, of course, it's going to be a paid one. So we can help you organize it. We have a business model around it, and we can get you resource persons. but you have to take the initiative. You can get in touch with me, write me an email, and I can help you with that as well. Because in person is always very different than online setting, and it's very much effective. So with that, I'll just end here. I'll stop sharing and hand it back to Dr. Sweety.
Thank you very much, Dr. Avneesh. I'm sure all the participants, the discussion was hand in hand at the same time while you were presenting. So that's a plus point. I think they're much on a faster track, right? Yes, it's very important. The summarizing AI in healthcare is that there needs to be a leader in place, and the leader has to be human, because we are talking about patients in real life. The data that AI or what we have been collecting, Chat GPT, or what the students use it for their medical work, needs to be trained. And I'm pretty sure with Dr. Avneesh Khare and other medical professionals involved, the training would be much more streamlined. And it is the interface of human and AI which will be game changing in the future. So if anyone has a specific questions to be discussed, you can chat, put it in the chat box, or raise your hand if you want to ask direct questions. I would request Dr. Sanjay Khanna, sir, esteemed president of the Indian Society of Study of Pain, to give a few words of thanks to this session today.
Thank you, Dr. Sweety, for giving me this opportunity to thank Dr. Avneesh. He has been a great teacher. He has not only taught us the subject, he has ignited very good curiosity in our mind. Your way of teaching AI has transformed a complex field into something which is very fascinating, I should say practical, and it was also enjoyable. Thank you for making the learning an inspiring journey. And we would be looking forward, Dr. Avneesh, since you have ignited so much of curiosity in our mind, we will be looking forward towards you for more such sessions where we can really start using AI, and then when we'll be facing some problems and questions, we'll be looking back again to you, and so that we can solve those questions and be wiser enough and happier enough. Thank you so much. I'm short of words, and I'm very, 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 very thankful to you for this session. Thank you.
Thank you, sir. So I've answered a few questions in the chat, and I understand that many people will now use these things and then they will have questions. So always happy to answer on LinkedIn for sure.
Can you share your number or your WhatsApp number so that
WhatsApp I sometimes miss, so a LinkedIn would be the best. I'll drop my LinkedIn profile in the chat. So
okay, that'd be nice.
Yeah, nice. So I'll drop it in the chat, and please feel free to drop me a DM on LinkedIn.
Yeah,
and I always reply.
Thank you so much. Thank you.
And also my email I will put.
Okay.
Yeah.
So this session was in collaboration from the ISSP and Vizag City branch of ISSP. I welcome Dr. Shrikant to give a few words of thanks from Vizag, also known as Visakhapatnam Pain Society. He's a general secretary. Please welcome.
Thank you, Dr. Sweety. At the outset, I would like to extend my sincere, heartfelt gratitude to ISSP National Headquarters, because in the last meeting itself, the discussion happened to give opportunity for the city branches to host, and Dr. Sanjay Khanna sir and Dr. Anurag sir readily extended and gave us the first opportunity to host, despite being a relatively young branch of ISSP. And I sincerely thank Dr. Avneesh for the excellent lecture, because a few months back, I gave a talk in the local medical college in Visakhapatnam on artificial intelligence in pain medicine. So at that time, I was reading all the related stuff and all, but the knowledge I gained today from your talk is way much more than what I prepared for that talk initially in the 6 months. I would love to be in touch with you and learn more things, and maybe we can put this to more practical use in our pain medicine journey. And it's so good to see so many big names and good practicing pain physicians from all over India turning up for this lecture and actively interacting. And thank you once again for the opportunity, Dr. Sanjay Khanna sir. Unfortunately, we are missing out Dr. Anurag sir, our National Secretary, due to travel today. Thank you.
Thank you, Dr. Shrikant. You have really made a very nice, good use of the opportunity that we have given to you. And we are looking forward for more such interactive sessions which can improve our members of the Indian Society for the Study of Pain. Thank you.
Thank you.
Thank you.
Dr.
Yeah.
So the concern right now, some of the participants have is regarding the apps from different countries, especially the Chinese apps.
Yeah.
Which I am pretty sure we are not in a
What about
station.
what about Chinese apps? I am open. See, it's a personal opinion. In why not use Chinese apps? Why not use the technology which is available out there? I have used some apps like DeepSeek, Chemi. All these are quite cheap and they give a very good result comparable to many of these Western models. I think it's a competition, more of a competition among these. Please be careful. Any tool, even Western tool, please don't put patient data directly. Don't put patient name, patient phone number, patient Aadhaar number, for example. If it is there in the report, you can crop it out. Or there is something like there are some tools available for that, which do that, like your electronic medical record if you are using. So there are some electronic medical records which anonymize your data and give it to you for research, and then that you can use. So even if that goes to some server outside, at least for now, there's no foundation on anonymized or de-identified data set for research. But be aware about DPDP Act, Digital Personal Data Protection Act, and always ask your electronic medical record person, is your tool DPDP compliant or not? Because from 13th of May 2027, it will be a mandatory thing for all people operating within India that digital personal data cannot leave the geography of the country. It has to be sovereign. It's a sovereign asset. So that is a new development which is happening. But Chinese tools you use for routine tasks. If you want to create a social media post, you want to do some routine work, go ahead and use it. No worries.
They're asking, is there any specific app you would suggest for an anonymous EMR record?
Yeah, so I told you one. I don't want to promote any EMR tool right here, but some of them, the Indian ones, like very famous ones. One is HealthPlex, one is Care. So you can talk to them, and they have some kind of functionalities depending on the tier, where you just click a button and it gives you in Excel sheet. It gives you your data in the required format. You can select the columns, everything, and it gives you anonymized data sets for your purpose. So you can do that. Otherwise, you can download it on a laptop not connected to internet. Do it on your laptop first, and then you use that the anonymized, de-identified data set. Identifiers, if you want to know, there's a list in HIPAA. There are 26 identifiers which need to be removed from any patient data, like name, phone number, your address, your Aadhaar number. If those are not there, I don't think it's a problem. It's okay.
Okay, to the audience and everyone present here, ever since COVID has happened, there are a lot of options that opened up and has connected different countries worldwide. We have gone online. There's a faster emerging of technologies, and as scientists, as educators, as researchers, as doctors, we all have unified and avoided the gap. So we are all on a uniform platform right now. Earlier, there were gaps in different countries because of the advancements and the reach that was not available. But what artificial intelligence, what the newer online way of communication and data sharing, it has helped us evolve ahead. So we do not say that a specific country, we would really want people in India to develop their own apps, develop technologies. But at the same time, Indian Society of Study of Pain is also part of International Association of Study of Pain, and the global family welcomes much detailed, deeper understanding, learning, so that we can grow as a specialty. The pain medicine as a specialty can grow. So it's also a request to all of you to become a member of the International Association of Study of Pain, ISSP. And there's a World Congress coming up this October. Be part of it. Push our country forward so that we also talk about Indian apps in future, Indian AI, and I'm pretty sure we all are intelligent, smart doctors who have worked really hard, and we have seen and accumulated a lot of clinical experience and a lot of clinical knowledge, but we haven't put it out there in the platform available, or rather shown that we have advanced to that stage. So thank you, Dr. Avneesh. You've opened eyes and opened the brains. I'm sure when they follow your steps in walking through each different apps or different platforms, that is when they will see where the milestones have reached or where there are obstacles. And yes,
Yeah.
a comprehensive learning
And,
is.
and this is very evolving field. So what I'm teaching you today might become outdated in next 3 months, 4 months, and there might be something new coming in. So similar way, you have to learn, unlearn, relearn, and you have to rinse, repeat. So that is the process, just like any other field. But AI is very fast moving. So that is the difference. So keep following each other, keep learning from each other, keep sharing with each other. And DPDP doesn't apply to research anonymized data sets. So you can very well share with your collaborators across geographies. There's a special reason why Indian government has kept that out of DPDP purview. So definitely research has to move ahead with collaboration.
Thank you. And we're superbly proud. Dr. Avneesh, please keep doing your good work, will and good work that you've been doing. And much thank you from everyone, especially from the Indian Society of Study of Pain headquarters and Vizag. Thank you. If there's any more questions, we are closing up. We'll wait for a few more seconds. If not, that's about it. Dr. Avneesh, you can close it with your closing remark.
But before Dr. Avneesh says, I would like to thank Dr. Sweety for moderating the session so nicely and with her comments at the end. And now the stage is open for Dr. Avneesh if he wants to say anything.
So nothing. I would like to again thank the entire team, especially Anurag sir. He was my examiner for my PDCC examination in BHU. And when he reached out to me in the last webinar after that finance talk, he told me, Avneesh, can you do on AI? So I didn't have a second thought. I had to say yes. And it is now only because of him that this has been possible, and the entire team came together. I had a talk with Dr. Praveen, then Dr. Sweety reached out, and today was excellent moderation and excellent teamwork. And I hope you all learned something new, at least one thing new, if not everything, because this was supposed to be a basic kind of a primer. But I encourage all of you to keep learning, stay in touch with me. And if you have any mentorship need, or you want to do some kind of a project where you need some kind of help, I have a huge network where I can get you connected. I can also get involved with you if possible, and we can do something together and take this forward. Not just stick to this ChatGPT, Gemini, and Perplexity tools, but to actually go to that original AI also, which is very useful for our clinical purposes, like classification, regression, prediction. Those kinds of things are going to actually make the real impact in our clinical pain medicine. So you don't just get straight away with generative AI. Please focus on the original, boring, traditional AI also. That would be the message.
Thank you. Thank you. Thank you so much.
So thank you.
Can we now end the session?
There is one final question in the chat box, sir. Dr. Girish Bhatt is asking, can Glass Health be connected to Claude with a MCP?
So we'll have to check. I've not checked this in Claude. You'll have to check, or you'll have to go to Glass Health website and check if they give a MCP. So MCP is, for those of you who don't understand, is how you can connect Claude to some external tool. So for those of you who trade in stocks, you can connect it to Zerodha MCP. You can connect to Claude, and then when you chat to Claude, it will go to your Zerodha account and bring information, of course, with your consent, and then give you personalized insights. So MCP is like a connector between that. So that is available for Glass Health or not, that I'm not sure. I've not checked, but definitely if it is not there, you can request them. You can give them a request to please make one. So they can do that. Thank you.
Thank you, everyone. It has been a wonderful evening today, and good luck and great future to you, Dr. Avneesh Khare.
Thank you. Thank you. Bye. Have a nice weekend. Bye.
Namaste.